Good day to you, Guyana, and welcome to another edition of Facing the Nation. I am Malika Ramsey. Thank you very much for joining us again this week. Well, today we are going to focus on the health sector. For 2 weeks, I have been promising you the Minister of Public Health, Dr. George Norton, and then we had to push it back 1 week and then another week. And of course, I did let you know that he was out on government's business, and he's going to talk to you about 2 trips that he had in 2 consecutive weeks. So it's my pleasure to have him on. But also coming up on the second half of the program, as you know, Parliament, they had their first sitting after a long break. Parliament had the first sitting yesterday, Thursday, in the National Assembly, and the President of the Cooperative Republic of Guyana, His Excellency Brigadier David Granger, addressed the House. So we'll be bringing to you a clip of that address, at least a big chunk of it. We'll try to get as much as possible in. But for now, we're going to focus on the health sector. And again, Dr. Norton is no stranger to this program. The Minister of Public Health, Dr. George Norton. Welcome back to Facing the Nation, sir.
Thank you very much, Ms. Ramsey, and a very good day to televiewers. And it is a pleasure to be here today. I know that I was a frequent visitor to this particular program, but of recent, I have not been so frequent.
Yes, that's okay. We forgive you for that, because as I did say to the viewers, we know you're out conducting government's business. And on the note of government's business, let's talk about the 2 trips that you had recently. I think you went to Washington and then you also went to Panama. Let's talk about those trips.
Yes, myself and Dr. Karen Gordon-Boyle, the Deputy Chief Medical Officer, we had a visit or a work trip to the Washington, US of A, where we attended the Director Council of the Regional Committee on World Health Organization, as WHO for the Americas, and the meeting of the Council for Human and Social Development, COSOD. At that meeting in Washington, we discussed the regional health strategy. We also had the Caribbean Sub-Regional Certification Committee reporting on polio. We discussed health financing, which is a very important aspect of our situation here in Guyana, simply because, you know, what is true for Guyana is the statement that there's no free lunch. And while we have that lofty ideal in our constitution where it states that, you know, everyone has a right to free health care, I must say openly that health care cannot be free, while one might not be actually paying for it in terms of monies out of pocket. Somebody somewhere along the line has to pay for it. So health financing was a very important discussion that we had.
Okay. So that we can definitely take things away from that trip and those discussions that can help to strengthen Guyana's health sector.
Definitely. There is no doubt that in terms of providing a higher quality of healthcare to the nation, we have gone into private-public partnership. A typical example is that of our Caribbean Heart Institute, where the government did spend monies in acquiring equipment, but the expertise and other consumables were provided by the partnership. And gone are the days when we had to fly people out of Guyana to the developed world to have an open heart surgery or stents implanted and so on. That can be done right here in Guyana. However, it is definitely a situation where if the Guyanese public, in spite of having these facilities here in Guyana, have to go into the pocket at the time of need to pay for health care, everyone will not be able to enjoy that.
Okay.
And that is what exists at the moment
All right.
for particular services.
As we stay on that, of course, Congratulations are always in order when there are improvements in any sector, especially in Guyana's case, especially for the health sector. This is not me pouring cold water. This is what is happening outside. Even though what you've just explained is that we are at a level and we have somewhat improved, but there are persons out there who may say, well, the health sector really and truly is in a bad state. It's in poor taste. So everything that Dr. Norton is talking about now is just basically window dressing. Those are the sentiments that you would hear from outside. How do you address such sentiments? And in your opinion, if there is a problem in the health sector, how do we go forward and how do we fix those problems?
I will be the first to confess that the situation is nowhere near where we would like it to be. Mm-hmm. We are not comfortable with the state of delivery of health services to the nation. I am not going to say either that we have not improved over the past decades or so, but I'm saying that this government is not going to sit idle by, accept things as they are, and not make the best effort on improving those conditions. That we are doing. We have changed some systems that we thought was not suitable, particularly in the procurement system, area. We had a system in place where one company was enjoying a large portion of the supply of pharmaceuticals and medications. That has changed. We have moved to an open tender process, competitive bidding. In so doing, there are always some limitations. There are always some bottlenecks, some teething problems, and we have encountered that. It is a fact that we might have not been able to distribute medications that we have available, but it's part of the change that we are putting in place. There's no doubt about the fact that in spite of efforts being made, a lot of human factor has to do with whether or not a village would have access to all that we can offer.
Okay.
But we are quite conscious of it, and we are working to correct that.
Okay.
Our methodology might run us into difficulties, but we are not afraid to admit that we are learning from our mistakes. But I can assure you that we will not go breaking down only to build back, and we will not go reinventing the wheel.
Okay, all right, great. We still have the Panama trip to come to, but I just want to get some things surrounding this out of the way, and as you talked about the improvement. Recently, weeks ago, maybe it's more than a month ago, health workers at the Georgetown Public Hospital Corporation came under fire. Usually when one thing happens, the entire core, if you want to call it that, of health workers, especially in the public system, would definitely get the blame, and you hear how they're lackadaisical and lazy and all the things that you hear. And you understand that because people become very emotional. And in this case, I'm talking about that incident where the woman delivered the baby on the floor and then the baby's skull was fractured. Several things here, Dr. Norton. How do we fix that? And apart from even before we talk about fixing it, where is the investigation into that incident right now?
What is good to know is that we are as much concerned about the baby and the baby's relatives, including the mother, about the health and the sequels of what the baby can be suffering from. We have not abandoned the baby in terms of trying to evaluate and follow up the baby with medical facilities. But at the same time, it is a situation that we are doing everything to avoid it happening again. And one such area is by investigating what exactly went wrong, what need to be put in place to avoid it happening. It is not a situation where you rush in and you accuse without evidence. It's a situation that involves the career of someone, It's a situation which involves the health status of a person. Hence, we are going to allow the system to work. By saying so, I'm cognizant of the fact that many a times people think that we sweep problems under the carpet.
Yes.
That is not going to be the case. We are going to allow the chips to lay where it falls. But we are going to do the investigation that we are supposed to do. After that committee, which is empaneled at the Georgetown Public Hospital, concluded, they will then make recommendations to the Nursing Council, where they will decide on what sanctions will be taken if that is supposed to be done. And also, we would want to see that recommendations are put in place so we can avoid such a situation from happening.
Dr. Norton, and this is not going after anybody or anybody's jobs, because you did say that in this case we have to look at people's career and their bread and butter issues. But this is apart from your ministry and possibly the hospital's own investigations and their own panels. Do we have legislation being on the law books that not only any health worker in cases like these and other cases, because we've heard so many other horrific stories when it comes to what's happening at the Georgetown Hospital. Do we have legislation whereby health workers can be held accountable when these things happen, and if they are found to be culpable or irresponsible or whatever word you want to use in whatever situation?
There's no doubt about it. No doubt about it. Any malpractice, any form of negligence, any form of, let's say, a undue actions by any health worker, of course, they're subject to the law like any other worker. But also within the Ministry of Public Health, we have systems in place. And a patient or a patient's relative has got the options of the laws of Guyana to protect themselves.
Okay. All right. Viewers, if you're now tuning in, of course, today this is a conversation with the Minister of Public Health, Dr. George Norton. We're talking about the state of the health sector and some other improvements and so on. Let's move on to because we started off by talking about your trip to Washington. Let's talk about Panama, what happened in Panama and what we can take away from those meetings.
Well, in Panama, between the 4th and 6th of October, the PAHO WHO had a meeting in Panama City for Latin America, the Caribbean, the United States, and Canada to prepare the hemisphere for the 7th meeting of the Conference of Parties on the WHO Framework on Tobacco Control. That's COP7, which is going to be held in India between the days of 7th and the 12th of November. So that meeting was held because, of course, Guyana is on the verge of, that is the government, of passing the anti-tobacco legislation. It is not a simple legislation. It has got local, far-reaching, as well as international implications. And we would not want to rush into passing a legislation that is not effective.
How, in terms of what you've researched and how you're working on it, how long do you see that passing, and why is it necessary for Guyana to have that, the anti-tobacco bill?
Well, there's no doubt about the fact that tobacco smoking, the products, is a high risk for the 7 causes of death. Okay? And the long-term effect of tobacco smoking affects negatively the health of a nation. And, since in 2007, what is referred to as the Port of Spain Declaration, CARICOM nations all signed on to that declaration, where every effort would have been made to put legislation in place against tobacco. Except for Guyana, all the 4 major nations in CARICOM have tobacco legislations in place, including Suriname. So with Guyana complying and getting that in place, the major players in CARICOM will now have, and it would be easy for the others to follow suit, the small islands.
Okay, all right. So anything else that came out of the meeting that we can use?
Except to say that persons are looking forward, the other members, territories, are looking forward for Guyana to once again play that leading role. And we hope to do so, and we hope to pass that legislation without much opposition to that legislation.
All right, great. Thank you very much for that, Dr. Norton. Now, there's something else that it really is affecting society. We continue to see these horrific traffic accidents. And I know to some extent it falls under the Ministry of Public Health, but what I want to know now is how can road safety activities be integrated in public health work?
Well, first of all, there's no doubt about the fact that, Guyana has a very high road fatality rate.
Mm-hmm. Too high.
It's definitely too high. And when one look at the cause of it, most cases, quite a lot, speeding and driving under the influence. Like we're looking at the anti-tobacco, we're hoping in the near future to have legislation in place to see if we can curb the excess use of alcohol, and particularly to reduce that driving under the influence of alcohol. Okay. So it concerns health. One knows what happens when an accident takes place. 4 or 5 persons at the same time rushing into your institutions, needing not only surgery but a large amount of consumables that certainly we can put to better use, so to speak, if we could have avoided that accident.
And it's obviously it would be taxing on the health system, and this brings me to another question. Earlier you spoke, weeks ago, you spoke about the fact that there is a shortage of health workers. I don't know if it's specifically nurses at the Georgetown Hospital. Let's talk about how your ministry can address that and how soon we can see those things being addressed.
I'm glad you bring this into the public forum, because we can have the best infrastructure in terms of buildings, operating theaters, the most expensive equipment. We've got a hybrid CAT lab available at the Georgetown Public Hospital. We're installing 2 CAT scans, one at Bartica, one at New Amsterdam. Mm-hmm. We are building a new hospital in Port Kaituma. Now we've got to ask ourselves, do we have the human resources to man these centers? Do we have the human resource that is suitable, qualified to man these centers? And I can safely say to you, no, we have not. At the Georgetown Public Hospital, we probably have a vacancy for 300 nurses. Try to imagine how much are you taxing those that are there.
Currently, you have a vacancy for 300 nurses?
Yes, we have. So when most of the night shift, you might find that somebody is working probably double shift. Somebody is doing the work for 2 persons. Guyana is a country that has a certain climate that really can be telling on your endurance, on your physical strength. So many times persons might be literally burnt out in the performance of the job.
And that is very dangerous to have burnt out people working on sick people working on patients. But what is the problem? Is it that we're not training enough medical personnel? Is it that we don't have enough persons doing enrolling into the Georgetown Nursery School? Why such this 300? That's a lot. Why such a big number when it comes to shortage?
Attrition. We've had persons do we train and they leave. I remember the folly of the statement being made in Parliament that, let them go, we will train more. That is not going to work. That is not going to work. Even if we increase I remember one minister boasting about the number of nurses that he has enrolled. That is not going to work either. We've got to not look at quantity. We've got to look at the quality, because we end up with a situation where we have persons becoming nurses because it's a job. Being a nurse, being a healthcare facility.
They don't really like it, just to pay the bills.
And we've got to be careful about that. We've got to look at the conditions of these workers, where they're living, how far they have to travel, what are their job satisfaction, their social
Because
security.
I'm assuming those things are lacking, that is why they're leaving. Even while government works to improve those things, living conditions, travel arrangements, the cost of living for them in general, because I know for a fact, we always say our teachers, and our police officers, you're supposed to have them basically on a pedestal, because they're the ones who keep us healthy and they're the ones who protect us. But is there some way that after they would have been trained and they would have gained experience here in Guyana, how else can you keep them here, keep them from leaving?
Well, we certainly, this new government, if I might call it new, is moving in that direction. We've had an increase in salaries that they have never witnessed before. They have never enjoyed before. Okay, this is not, and this is from the time we got into government to now. The increase in salaries and benefits, the workers have never enjoyed this before, and we hope to continue. And in so doing, we are also expecting that we will retain much more of our health staff in the society.
Okay, all right. Viewers, I have to begin to prepare to wrap up with Dr. Norton very soon, but just two other things before we allow the Minister of Public Health to get back to his schedule. Now, Georgetown Nursing School, what plans are there to, again, change, better, improve the situation there at the nursing school?
We are training our tutors. We are training our tutors. We have a joint program with the United States, and we are doing that, as well as we're improving on the infrastructure that they have. What is unfortunate is that, we came and found some projects in place. For instance, the construction of the Georgetown Nursing School. The plan is excellent, but for some reason or the other, the monitoring of the work that is carried out by the contractors seems to be lacking. And as a result, it's either they're not doing the work, it's either they cannot complete it on time, it's that they're not living up to the expectation, and that we intend to change. We've already started doing so, and we hope that in the near future that we would be able to correct those situations. But we are improving. We're improving on the conditions. We are giving them more teaching materials, more simulations, and we hope to improve, as well as working on the human relations, because that is what is lacking. We find that persons are sick and they go and expect a certain manner of treatment,
yell at them,
right, and they're not getting it.
Women who would have just delivered tell you some stories. They shout at them. I mean, women are in labor pain, and you hear nurses telling them, "Oh, shut up, keep quiet. You should know you should know that there's the pain you got to experience." I mean, that's unacceptable.
I have been in the system before. I'm aware of this. I cannot visit the Georgetown Hospital without wanting to go to the maternity ward. I have been there several times. I've met with mothers. I've met with the staff. I know them well. And, I am making every effort to change that situation. And I'm appealing to the nurses, and I'm appealing to the public also to understand the situation. There's one thing I want to say on this program, and it's not because I'm shirking my responsibilities. It is not because I think I'm inefficient, but the level of the amount of work that is out there to be done, quite to my disgust, cannot be done as fast as I would want it to do. And it's going to take some time. I'm taking over from a situation that has been building for 23 years, and it's not going to change in 2 years. And I must tell you that we have persons out there who reach you, who write you letters, who threaten you by saying, we voted for a change and we were expecting a change.
I see those letters every day.
Yeah, that change is not going to come in 2 years. And I am the first person to admit that I don't know it all, and we are going to give it our best shot to get that health system the way it would improve.
Okay, great. Dr. Norton, as you know, one of the things I like to do, and of course I'm beginning to wrap up viewers, one of the things I like to do is, because the persons on social media who necessarily can't get to the ministry or the minister directly, they would have their questions. One of the questions I got today is about the Bartica Hospital mortuary. There is a claim that it hasn't been functioning for some months now, and the real horrific thing about it is that it's alleged that people have to put ice on the bodies of their loved ones. Is there any truth at all to that claim? And how soon, can we see that situation changing? Because I'm also told that is the only mortuary in the town of Bartica.
Well, I must tell you that, and this is because I've been there, that Bartica has a well-constructed mortuary.
Okay.
With freezers, clean, and I said well constructed. I was informed that about a week ago, or a little over a week ago, it was broken. But every effort is being made, and before the end of this week, probably today or tomorrow, they will get that mortuary functioning. What was expressed to me in some amount of disgust was that such a report saying that the mortuary has been down for 2 months is totally inaccurate. And while whoever laid the complaint has the right to come to you, to go to the social media, they also have a right to ask the authorities at the Bartica Hospital so that they can get the facts as it is. Because we're finding that this is a situation where persons want to go to the media rather than finding out from the head of the institution. People run to the minister because the minister's got an open door, and you ask, did you speak to the director?
Yeah,
did you
chain
speak
of
to the
command.
Right. And I am disappointed because what are we going to gain? Is it just we're looking for things to criticize? Can't we be constructive in trying to help rather than wanting to destroy? Is it that we must paint a negative image of what is taking place? And it does not help because, you can say so many bad things about the doctors and about the nurses, but I don't think I've ever met any of my colleague health workers who deliberately set out to make someone suffer unnecessarily. I am still convinced that all the efforts, in spite of the mistakes that they might have made, was done because they thought at that point in time it would have helped. Many times it does not. But I don't think that anything would have been done deliberately not to get that mortuary functioning on time. Calling the director, and we have the director of the hospital, we have the matron of the hospital, you have regional let's say, officers there, rather than calling to Georgetown to the media, they could have done so. And I get that distinct impression that was not done.
I figure that's why they took the safer way of coming directly to me, because they know I'm not going to put it out there in a way that's going to bash the government. But the explanation is granted. Before I let you go, just to spin off of this question, do you have a system in place where, if not yourself, but regular visits are made to hospitals, medical centers, health centers countrywide, especially in our hinterland communities?
Well, to some extent, I feel I can make a change in the health system. Why? Because before I became minister, I made it my duty to go out into those areas, right across Guyana, from Morowano in the north, right down to Masikaneri in the south. And whether it's from Oriala to Purima rather, I've been there. And if I'd done that when I was not the minister, I feel it's my obligation to continue to do it now that I'm the minister. But I must say this, that it is not the minister's job to go fetching medication to the health centers in the region. We have to put systems in place. While I know that sometimes the ministers get it done by just a phone call.
Yeah, by just being the minister.
Right. We have to do better than that. The minister's there to do policy work, to make policy decisions. It's our officers, it's our doctors of the region, it's our nurses, it's our medics, it's our community health worker. And, while I said that the whoever was complaining should have spoken to the authorities, I am grateful to the media for bringing these things to light, because when they do so, at least I'm knowing about it, I'm hearing about it, and I act on it. Okay, however, it just like the media can receive a call from somebody who's complaining about something, I think the media can make a call to the minister or whoever's in charge, just to add another view or another situation to what is, rather than going openly without. Granted, yes, that you might not be successful in communicating with the minister, because he can be in situations where he can't even answer the phone in spite of seeing it ringing.
Yeah.
Okay, and that happens to me ever so often. Yet I still think that efforts can be made to have, let's say, a balanced view on situations. But I would want to leave here to say that I am grateful to the media for all they're doing in covering in whatever way the situation of health in Guyana. If it's negative, so be it. If it's positive, then we're happy.
Great. Well said, Dr. George Norton. Thank you so much for visiting Facing the Nation. And, of course, thank you for taking time out. Viewers, of course, this has been a conversation with Minister of Public Health, Dr. George Norton. For those of you who you're now joining, you missed a really great conversation, informative one. Those of you who follow me on social media, subsequently, the conversation will be on YouTube and also on Facebook. What I'll do now, as I did promise earlier on the program, the second half of the program is dedicated to the President's address, his presentation in the National Assembly yesterday. So take a look at a part of that presentation. Of course, by the time I get back with you on Facing the Nation, it will be time for me to wrap up today. Of course, only one guest we are having today. This is Facing the Nation. Stay tuned.